Welcome back, everyone. Now we continue from where we left off, and we're going to look at the relative radiosensitivity of the human cells. We are going to briefly look at the radiosensitivity of the body structures, and we're going to explain the potential risk to radiosensitive organs resulting from radiation exposure received during diagnostic imaging procedures. We have covered these terms already, but it's worth looking at it again because we are looking at radiosensitivity of organs. Now, looking at somatic effects, those are the ones experienced by the exposed individual, the entire body, whereas the hereditary effects do not become apparent until subsequent generations are born. So the next generation, your kids and your kids' kids. Stochastic effects are those long-term effects. They're usually linked to chronic exposure, and they delivered over a period of weeks or months. The somatic or long-term effects of radiation are usually linked to stochastic, and examples are cancer and cataracts. Then we had a look at deterministic effects. Those are the short-term effects. They are acute exposures, and those are delivered within a day or two. There are short-term somatic effects that are caused by high exposures, and acute doses of radiation below 250 milligray are unlikely to have any observable effect. So acute dose of a short period of time but low in intensity is not going to show up immediately. Acute doses of above 3 to 5 gray, now they're going to show a significant effect. The effect is determined, and there's a 50% chance that it could result in death some weeks after that exposure, and especially if there's no medical treatment. And then lastly, radiation injury. This depends on the cell's radiosensitivity. Remember the law of Bogoni and Troubadour. It depends on the type of the cell, it depends on the body organ, and of course its maturity level. Radiation exposure that is confined to only one area is said to cause less injury and risk than a whole body exposure. Now the reason is, although there may be severe damage in the affected area, the high proportion of unaffected tissues will compensate for the loss. Larger doses of radionuclides, that's particulate radiation, entering the body by inhalation or ingestion are usually due to accident situations. Now, we need to be prepared for accidents, and that is why we need to be educated on the sensitivity of these organs to radiation and how they may be affected. If a radiation accident occurred, internal exposures may be uniform in the body, or they may affect particular body organs. Inhalation or ingestion of food or water that contain radiation will lead to a uniform irradiation of the soft tissues of the body as it travels through. Radiation that passes through the bloodstream or lymphatics will cause severe internal damage. This, of course, will depend on the amount and the type of radiation exposed to. Now, looking at the organ sensitivity chart, let's for a moment focus on the thyroid. I don't know if any of you had the opportunity to watch the HBO series Chernobyl. I'd like to make is that the core nuclear reactor, which exploded in Chernobyl, contained uranium atoms. And now these atoms, they split into smaller atoms. Most notably was iodine-131. Iodine-131 is radioactive, and it fires off neutrons and rapidly decays. This is important in trying to explain the sensitivity of the thyroid, because iodine concentrates in the thyroid gland. Now, going back to the Chernobyl series, a female scientist involved in the investigation of the incident, she encourages people to take iodine tablets to prevent any acute effects of iodine-131 radiation. She knows that radioiodine concentrates in the thyroid gland, causing large doses to the small thyroid gland and the surrounding tissue. In extreme cases, the thyroid may even be destroyed. Now, taking iodine tablets helps because the body can't tell the difference between radioactive iodine and an iodine supplement that is safe for the body. So the thyroid will hungrily absorb whatever iodine it receives. If the radioactive iodine or iodine-131 is absorbed, that iodine is normally sitting in the body, spewing out radiation into the surrounding tissue and damaging the DNA. So taking a large dose of iodine supplement in theory will stop the body's hunger for the substance and prevent absorption of the harmful iodine-131 once it arrives to the body. It is important to note that after the Chernobyl incident, there was a spike in thyroid cancer in children in the affected area. In one of the worst hit regions, thyroid cancer rates in children increased to 100 per 1 million. Systemic effects is a term used that refers to the effects on the body that are radiation-induced and that can be structural or functional. Let's use COVID as an example. The COVID disease, is like a bad case of the flu, they say. It can attack the lungs and stop its normal respiratory function, or it can affect the entire body. Now, when this happens, this relates to a systemic effect, as the entire body can shut down and lead to death. Radiation systemic effects behave in the same way. Radiation effects are severe when the doses are high, and the outcome is immediate, but effects in the body can also be delayed and lead to detrimental consequences. The systemic effect will depend on the dose received, of course. Was it low, below 1 gray? Was it moderate? Or was it high, above 10 gray? The questions we should be asking ourselves is, can the body regenerate itself after a certain amount of radiation is received? And is it possible that the body will repair itself, or will mortality be increased? As mentioned before, the dividing cells of the blood-forming system, such as the lymphocytes, are the most sensitive or radiosensitive in the body. Now, lymphocytes, they defend the body against foreign objects, antigens, and they do so by providing protective proteins, which are called antibodies, to combat disease. Lymphocytes, which live for only approximately 24 hours, have the shortest lifespan of all the blood cells. Ionizing radiation adversely affects blood cells by depressing the number of cells in the peripheral circulation and weakening the immune system. A whole body dose of about 0.25 gray, delivered within a few days, produces a measurable hematological depression. Now, how do we know this? Well, during the 1920s and the 1930s, before the use of TLDs, periodic blood counts were used to monitor exposure of radiation workers, and during this time, it was discovered that about 0.25 gray dose of radiation can depress the blood cells, leaving the body open to infection. However, that being said, a dose of 0.25 gray far exceeds the normal doses we are exposed to in X-ray imaging, and therefore the use of blood tests for the purpose of checking occupational dose is no longer valid. It is important to note that when a significant number of lymphocytes are damaged in the human body by radiation exposure, the body does lose its natural ability to combat infection. So to add to what I've just said about the body's defense system being down because of blood cells being affected, blood cells decrease or deplete when they are in the presence of radiation or they've been exposed by radiation. There will be an overall decrease in the number of immature blood cells, stem or precursor cells, produced in the bone marrow as a result of the exposure. Now, if the bone marrow cells have not been destroyed by the exposure to ionizing radiation, they can repopulate after a period of recovery. The time necessary for recovery depends on the magnitude of the radiation dose received. And if a relatively low dose, less than 1 gray of radiation, was received, bone marrow repopulation does occur within weeks after the irradiation. If it was exposed to a moderate amount of radiation or a high dose of radiation, this will not recover as easily, of course, and a longer period of recovery will be required. Now, if the doses of radiation are very high, this can cause a permanent decrease in the number of stem cells. After an acute whole body dose, changes can be observed within hours, not only in the bone marrow, but in the lymphoid follicles and in the blood count. The maximum depression, however, occurs only after a period of roughly 2 to 5 weeks, but infection and hemorrhage are the main causes of death when exposed to high doses of radiation. Human beings who receive whole body doses higher than 5 gray may die within 30 to 60 days because of the effects related to blood cell depletion. Now let's look at the effects of radiation on the eye. The eye lens is quite sensitive to radiation, and there are usually two basic effects that occur. There are detectable opacities, or there's some visual impairment, and cataracts could form over the lens of the eye. At high doses, lens opacities or cataracts, they develop within months and progress rapidly and eventually could cloud the lens completely. At lower doses, opacities may take years to develop and remain microscopic in size and can it won't cause a total loss in vision. But based on several studies, it seems that the dose of more than 8 gray of X-ray or gamma radiation is required to produce a vision impairment or a cataract. And this exposure levels of 8 gray is well below the exposure conditions typical of radiation workers in our field. We only deal with small doses that are spread out over a long period of time. And how about effects on the skin? If you should suffer an acute exposure to beta radiation externally, only the skin is affected because the vast majority of beta particles do not have enough energy to penetrate any deeper. However, it is quite nasty when it's ingested or inhaled, right? Internally, it is very damaging. If the dose to the beta was external, though, the damage will depend on the dose received. The effects on the skin will range from temporary erythema, and erythema refers to reddening of the skin. At around 5 gray, you usually see this, or it could be desquamation, which is the surface layer or peeling off of the skin. And in severe cases, there's necrosis or death of the skin, and that only occurs at about 30 to 50 gray of radiation. For such acute exposures, the effect would usually show up about 2 to 3 weeks later. The treatment required for high local skin doses is similar to the treatment given to thermal burns. Injury caused by radiation, though, takes much longer to heal because the damage is much deeper than for burns. Hair follicles are more sensitive to radiation than the cells of the skin, and an acute dose of 3 to 5 gray can lead to temporary loss of hair, and this loss can become permanent after a dose of around 7 gray. In this slide here, which I obtained from the IAEA website, you can see an image of the skin, and here there's skin damage from prolonged exposure to a general fluoroscopy procedure. This slide I've also obtained from the IAEA website, and in this picture right here, this is a 17-year-old female. She had cardiac ablation, and this is basically a procedure where they correct the electrical signal within the heart when it's abnormal. And during this procedure, diagnostic catheters are threaded through the blood vessels into the heart, where they can use the catheter to map the heart's electrical signal. And during this procedure, obviously too much radiation was given and the patient suffered some skin burns. How sensitive do you think muscle tissue is to radiation? Now, because muscle tissue cells are highly specialized and they do not divide easily, they are relatively insensitive to radiation. They are radio-resistant. Now, before we continue on to the central nervous system, I want everyone to take a 10-minute break, and then I'll see you back here real soon.